There's about 180 countries vying for the personal protective equipment in the world, and this has pushed up the demand and led to prices to skyrocket. South Africa's special relationship with China and India has enabled the country to source more protective gear from them. The country has now sourced orders for personal protective equipment, ventilators, oxygen machines, valued at 69 million rand. This was made possible by the donation of the Motsepe Foundation, the Solidarity Fund, the Spear Fund, and Naspers. But concerns have been raised about some companies selling fake products.
All over the world, there's a huge contestation. And in South Africa, the prices of the personal protective clothing and equipment is really excessively high. But we really have no choice. And I can talk particularly from the Motsepe Foundation perspective, as well as companies that we are associated with. And I must say the partnership and the cooperation and the leadership that Stavros has provided, both from Business for South Africa, as well as with the Solidarity Fund, there's been lots of interaction. And we are sourcing, because there's also a lot of fake products. I tell you, it's unbelievable.
The Department of Health says no health worker must be forced to work in places where they feel unsafe, and has reiterated that the National Occupational Health Safety Committee will meet regularly to discuss safety issues in the health sector. The department says the public and the private sector must work together to guard against skyrocketing prices.
With the rising prices, one individual does not need thousands of stock, therefore they might actually be vulnerable because of the price gouging, that's what you call it. Price gouging that has happened, a new term that I've learned. Now, I just call it profiteering. So that we have agreed that the association that represents the private practitioners will be represented in the government, public sector, private sector platform, so that we can look at what is it that can be done to make easier access for the private practitioners.
So far, the department has stock to last for the next 8 weeks, and that orders valued at 800 million rand is expected to be sourced in the coming weeks. Naledi Matlapeng, SABC News.